Welcome to the National Women's Fitness Academy podcast. We're here to talk about women's health, female hormones, body image, and all things health and fitness.
Hello, girls, and welcome back to another episode of the Women's Fitness Academy's podcast. I'm your host, Siggy, one of the WFA's educators and a women's online coach. Today is going to be an absolute cracker of an episode. You are going to learn so much from my special guest today that it's going to blow your freaking mind off. So let's get straight into it. Today, I'm joined by Dr. M'Lanie, who is a Chinese medicine practitioner. Now, before I go ahead and say how amazing she is, I'm actually going to give her the opportunity to introduce herself and explain to you all what exactly that means for her to be being a Chinese medicine practitioner. So, M'Lanie, welcome.
Hi, thank you. So as a Chinese medicine practitioner, I practice acupuncture and Chinese herbal medicine, as well as supplementation. So we use a combination of the three, as well as, you may have also heard of cupping or scraping, gua sha. So we do use different modalities as well to sort of heal the body, and also just keep it healthy, just maintenance as well.
I love that. And how long have you been practicing that now?
About 8 years.
Wow.
Lose track after a while. So it's been a while. And then, university is, it's a minimum 5 years for a Chinese medicine practitioner, and you do practice in clinic. We have a university clinic as well. So you get a lot of practice even before you become a practitioner.
Awesome. Love that. So let's take it back so our listeners understand what got you into Chinese medicine at the get-go.
Yeah, so it was actually bodybuilding. I was a bodybuilder. It was a while ago now. So just to give you a bit of a background into that, I kind of just fell into it. I had gone to a gym where they do actually specialize in training girls for competitions. But I just went there initially for some personal training. I just wanted to lose a bit of weight. My coach at the time was like, do you want to compete? And I had no interest whatsoever in it. Every day I came in, he was like, you're going to compete. And eventually I kind of just, yeah, all right, whatever. And so it kind of started out that way. I was very naive going into it. I didn't realize what I was really in for. I had come from yo-yo dieting, probably body image issues as well. So in my instance, it kind of exacerbated some of those issues. Mm-hmm. So I did that on and off for about 8 years. I trained the whole time, but I competed on and off like a number of times. I had issues come up throughout it, but again, being so naive, I wasn't getting any help. I wasn't supplementing apart from magnesium. And I'm the type of person who will just push myself until I break down, and then I'll just push a little further. So by the end of 8 years, I wound up, after my last competition, I was, mainly it was the anxiety for me. Sorry, not anxiety, insomnia, although anxiety, yeah, as well. But mainly the insomnia. I was also having night sweats. I was fatigued like all the time. Chronic back pain, a few other issues. So I went to a GP mainly for the insomnia. and he offered me either sleeping pills or antidepressants.
Oh, wow.
And I was like, I'm not depressed, I just can't sleep.
Yeah.
And for me, that was just like both of those options were just a band-aid. It wasn't really fixing what was at the core of my problems.
Yeah.
So I declined both of those options, and I had read that acupuncture was beneficial for sleep and insomnia, and I'd always been curious to try it. So I found a Chinese medicine practitioner, and literally from the get-go, I was like, I want to do what she does. Like, I walked out of that session just like blown away. That night I slept like a baby. I had a herbal formula as well. So, you know, it did take time to kind of really re-regulate, and you do need that. You need a couple of sessions when you, for years, have been abusing your body. But yeah, eventually it got me to a point where I was like sleeping like a baby. You know, my back pain was going away. Just had more energy throughout the day. So it was a couple of years then before I started studying. I was looking into it because I was really curious about Chinese medicine, the whole philosophy and everything like that. And yeah, eventually I started studying it. And that was kind of, there was so much effort, energy, and brain power that you kind of need to put into studying when you go into university, that it just was not really an option for me to compete anymore. I continued training, and I still do, but yeah, I kind of like, that was the end of competing for me. And so that kind of helped with the initial, like the physical symptoms. Later on then I went, you know, after all these lockdowns and everyone's put on weight, and so did I. And so last year, or the end of the year before, I was like, I need to do something about, you know, this weight gain. I felt uncomfortable in my own skin, and just really wanted to sort it out. I knew that I still had some issues in regards to food and body image and stuff from back in the day, but I didn't actually realize how deep that was until I hired a coach, and we started working on, you know, my relationship with food, with dieting. You know, I wanted to diet in a healthier manner than what I had when I had competed, because largely when I competed, my diet was boiled chicken breasts and steamed broccoli most of the time. Like, it was terrible. And I said to my coach, I want to be able to lose weight without, you know, having such a huge restriction on my food.
Yeah.
And also not spending 3 hours a day in the gym, you know, just a bit more balanced, you know. And so we worked on that. I ended up dropping 18 kilos last year, which was awesome. But I did have a lot of triggers along the way, and it, again, I used acupuncture to really help me with those core deep issues. But it also did teach me a lot about what my triggers were and where they stemmed from. And a lot of it, yeah, was just, I think, being mentally unprepared when I did start competing. And just not having that psychological support along the way. I mean, you know, if you're already going into something like competing with body issues and with food issues, that's a problem.
Huge problem.
So, yeah. So, you know, I did a lot of inner work last year with that. And I'm sure I've still got more problems, but it was a huge start in, you know, recognizing recognizing, what's going on, why I react the way I do, the habits that I have, all this sort of stuff. So, acupuncture and Chinese herbal medicine actually continues to serve me long after my competing days.
I love that. It's such a good perspective to get, especially for women in the fitness industry. And you made such good points regarding those who enter a competition, because most girls who enter a competition go in for the wrong reasons. They don't usually go in for the reason, whether it's to win, it's mainly has to do within their own body image.
Yeah.
That's quite disheartening. And then you also made a really good point that acupuncture was helping you to relieve some of those triggers. What were those triggers that acupuncture helped you?
So one of them was, in my entire time of competing, we had the same program. My program never changed, which sounds absurd now, but that's just how it was at the time. Last year when I was training with this new coach, he had told me that there was it was going to be 4-month blocks, and 4-week blocks, and there was a mistake made at one point. He got the dates wrong, and I got quite upset about that. And I couldn't figure out why until I realized, hang on a minute, it's because, I was told, I thought, and, it was an honest mistake on his behalf. But I think having such a long time of doing the same thing over and over, I wanted it different. That's why I chose them. But I wanted a different way of training. And then to have something stay the same when you were told it was going to change, it was just a trigger for me. And it made me really upset. But yeah, looking back on it, it was kind of like, okay, I know now why, I was upset, was because it's like, no, you told me it was going to change and now it's not changing. And, so, and it may seem like small things. It was, blew it up in my head at the time. But it can be just those small things that really, just trigger you. So that was just like one instance. But also the food, because I had such a restrictive diet when I was competing. There was things like we weren't allowed to eat red apples. I was only allowed to eat green apples. And so small things like that can really play with your mind when you're then told, like, I honestly did not believe my coach last year when he said that I could lose weight by eating a varied diet. I was like, I didn't believe him, but I was like, I'll give it a go. Because I was just so much in this mindset for so many years of like, this is, you have to be so restricted in order to lose weight. So, food was another big thing. Going back to the other point of I didn't care about competing, really. I found it absolutely daunting. I only did it because I wanted to be skinny. And I know that a lot of the girls that I competed with were the same. It was never really spoken about, but it was just like, it was the only time that you were really made accountable as you're in comp prep. But other times it was just yo-yo dieting. You would go from your comp prep, you would binge for a bit and then go back to, your comp diet. So that's another thing is, not being in that healthy mindset can really be detrimental to your health in the long run.
I can totally relate to that because when I competed years ago, I didn't do it for the reason to win. I did it for the reason to be skinny and to be liked, get that validation.
Yeah, absolutely. Yeah. And also when, coaches play favorites, and then that can, you know, be another issue, because it's like you get quite competitive within the girls, and then you're doing it for someone else. You're not even doing it for yourself. It's
Yes.
like you say, validation.
Yeah, it's dangerous. Very, very dangerous. You mentioned before regarding the insomnia, and also before we started recording, you also mentioned that you suffered from back pain during your comp prep as well.
Yeah. So I think the back pain was probably from being pushed. I mean, I was with a trainer, training with the trainer, not just by myself in a gym. And it felt like I was being pushed to, you know, not be using proper technique. So they would bump up the weight and then kind of spot me to a point where I felt like I was no longer doing the weight, or I'm not using proper technique. So I, you know, think that was a big catalyst in a lot of the back issues. And also, I mean, posing in itself is like such an abnormal position, and you're doing that like several hours a week. So, you know, that posture, you know, can add to it. Particularly, you know, some people just have the constitution of, you know, low back pain. Yeah. So it's in part, it comes up to your, you know, makeup as well.
Yeah, I get a lot of girls who complain about their back pain during comp prep, especially because of the posing, which makes complete sense.
Yeah.
Now, with your clients, have you ever, or do you work with girls who are competing?
Yeah, so I've got a number of clients at the moment, and yeah, over the years I have worked with a lot of competitors. So probably this night sweats is a big one as well.
Where does the night sweats come from?
So from a Chinese medicine perspective, it's basically when you use up all your yin energy. So that's like the substance. So I probably, as best I can describe, is when you're in a deficient state. So, and that comes from like all the exercising that you're doing, and also eating in a calorie deficit. It creates a heat at night, and normally at night your body temperature is meant to go down. So it's not that, it's kind of hard to describe, but it's because you don't have enough of this cooling yin energy during the night, you're so depleted. So you're actually feeling the heat in comparison, if that makes sense. It's kind of a hard one to describe. But yeah, basically you're just using up all your stores, and you're just like at a time that you're supposed to be yin and quiet and colder and asleep, you're just, you know, it's too much activity in your head, which is where the insomnia comes from. Yeah, and you just feel that hot sensation at night.
That's so common, and many girls don't speak about that as well.
No. A lot of people just attribute it to either perimenopause. I mean, that's the main thing. They think they're going into early menopause, and it's like, no, that's not the case. Like, we have herbal formulas that, you know, can fix it right up. But it's quite common, not just in people who are overworked, and that includes work as well as exercise. But people who are more active during the night, so night shift workers, I see it a lot in nurses who are doing night shift. If you're eating at kind of odd times of the day, basically you're doing activities that you should be doing during the day, but you're doing them at night, and that's causing you to feel this heat at night. So yeah, that's a big one. And also, I mean, if you are consuming thermogenics, which, and I'm not sure how much they do these days, but back when I was competing, everyone was on them. That can also contribute, you know. Then loss of periods as well is another huge one. And I mean, I hear this kind of, people say, oh, it's not normal. Well, it kind of is normal. It's not healthy. But if you are, you know, exercising so much and you're eating in a calorie deficit, of course your body is trying to conserve as much of its energy as it can. So what's it going to do? It's going to stop your periods. So yeah, technically it is normal to lose your period, you know, if you're eating in a calorie deficit. But yeah, is it healthy? No. But then, you know, 2%, 5% body fat's not normal either, so, or not healthy either. So it is kind of a normal physiological process that's going to happen. Problem is, I guess, is when it doesn't come back, you know, when you start, when you go into a reverse diet, or you are back at maintenance, or even then bulking afterwards. So, you know, that can be an issue. And I had that problem as well. I lost mine the first time. I think I lost it for about 6 months, which I wasn't entirely unhappy with, because I get bad period pain. So I was kind of like, oh, yeah, all right, it'll come back. But the last time when it was like, okay, it's not coming back now, you know, the acupuncture and the herbs really helped with that as well.
So how, for those who don't know, how does the acupuncture help with helping to get your period back? Like, what are some modalities that you would use as well with the supplements?
Yeah, so we would use acupuncture and Chinese herbal medicine, but also, you know, I think supplementing, at least when I was competing, was not done enough. You're using up all your body stores, so you need to, I mean, I recommend that men and women be getting blood tests regularly when you are competing. See where you're deficient. Quite often there are telltale signs anyway. So iron deficiency, vitamin B deficiency, you know, they're pretty clear signs when they are low. And really it doesn't hurt to supplement with them anyway. Particularly when you're in a deficit. But yeah, there's certainly supplementation can help with that. Just, I mean, you just need to feed your body basically. But as far as the acupuncture, it will help re-regulate hormones. The herbs, again, it's a case-by-case basis. So we really look at the person's signs and symptoms to determine which acupuncture points we use, and then also what herbs we would prescribe them. But it would, I mean, you're looking at a lack of blood. So the two main substances of like the yin and the yang is the qi and the blood. So qi is more like that energy, activity, and the blood is more like the substance. So it's yin. So you're, you know, by the end of a competition, you're probably deficient in both of them. So probably a lot of what we would prescribe, or more commonly would prescribe with the Chinese herbal medicine, is something to supplement the qi in the blood.
Yeah,
so it's just like food. I mean, food is medicine. Herbs are just like a concentrated form of medicine or of food.
Now, going back to the acupuncture, I've been seeing you for quite a while, and that's been more regarding the sleep. But when going back towards the loss of period, can you give our listeners maybe a little bit of a debrief of like certain points in the body that will help to, mitigate that process?
Yeah. So the first and foremost is probably stomach 36. So this is on your leg. So if you, I'll show you, but if you go like a hand width down from the eye of your knee and just off the shin bone to the lateral side, you've got stomach 36. This is a really good tonifying point. So even using acupressure, pressing on that point, often you may feel it's tender as well. So you can do acupressure yourself on those points. It is obviously stronger when you have an acupuncture treatment because we're actually like hitting, the nerves and inside the muscle. So we're stimulating it at a deeper level. But even still, you can use the acupressure points. And then on the medial side of your leg, again, like one hand width up from the ankle, you've got spleen 6. So that point, again, really good tonifying point, moving chi, tonifying chi. The spleen makes, from a TCM perspective, makes the blood. So whatever you're consuming, it's processed in the stomach, technically from a TCM point. And the spleen is responsible for taking those nutrients from what we eat and transforming it into our blood. So spleen has got a lot to do, the spleen channel, a lot to do with creating that blood, making sure that it's flowing properly, that we have enough of it. So again, then you're going, if you take a step back, if you've got any gut issues, well, then you're going to have a hard time absorbing all those nutrients in order to create the blood. So you've got to also make sure that your gut health is working properly. So, and any signs like bloating or having cravings, fatigue, particularly after meals, any sort of issues like that. If you're having diarrhea or constipation, also signs that something's not right in your gut. So I, most of the time, I feel like a lot of cases it starts in the gut, and you've really just got to get your gut right to begin with. Yeah,
gut health is so important. And many women don't realize that the gut health has involvement. Well, it's in correlation to your vaginal microbiome as well.
Yeah. To everything, to your immune system, to your skin, like so many things. It's just everything just starts in the gut. Like, get your gut healthy. And I know that sounds very simplistic because it can be very difficult for a lot of people. But, if you've got any issues, start with your gut, look at what's going on there, and go from there. Even a lot of people don't realize that, once after you've taken a course of antibiotics, that can have a devastating effect on your gut microbiome. And it can take, 12 to 24 months to re-regulate that, even with supplementation, whether it be probiotics or whatever it is. You've got to start somewhere, and usually it's in the gut.
And when we're talking about gut health with the acupuncture, I'm assuming there's also certain points in the body that help to, bring, I don't know if the right word is triggers, but bringing up those symptoms.
Yeah. So there are actually some fantastic points around the stomach that can have an immediate effect. So this is a case where we're using local points. So we can use local and we can use distal points as well. But the points around the stomach are really powerful, calming down, any discomfort. And also the uterus runs on, so this is your conceiving vessel. So it runs down through the stomach.
So for those who are not watching the video, it runs from the neck down towards the stomach.
It actually runs, from the vagina. This is your midline. So from your vagina all the way up to your chin. And then on the back, you've got another channel. But that runs like through your guts, through your vagina, through your guts, up into the throat. So that's some really powerful points that are not only affecting your gut, but they're affecting your reproductive system as well. And then you might have seen when people wear travel sickness bands around the wrist. So it's about 2 finger widths from the crease of your wrist. People wear the magnetic travel sickness, seasickness bands. So that point there in between the 2 tendons of your wrist is called PC6. And that actually helps to harmonize the intestines, which is why it's so powerful for seasickness and travel sickness. But it also is good at calming the mind. So it kind of harmonizes the heart and the mind and the intestines. So great for gut, any sort of gut issues, discomfort, upset, but also nausea, vomiting. It's a good one for pregnant women as well when they have morning sickness. So that's just like an instance where we can use distal or local points to treat different cases.
I love that. It's so cool to understand like the different points of the body and how it can like trigger certain points, of our gut health, a period health, back pain.
Yeah. And it's still like, even so many years later after, practicing and all the things that I know, it sometimes blows me away when I do a treatment on someone and I'm like, oh, wow, that was amazing. I treated a guy once who was having like really bad toothache, and there are points on the toes that we use for that. And he'd had surgery. He was away from home. The dentist, I think, hit a nerve or something. They'd given him painkillers, which were not relieving it. And I did one treatment on him using points on his feet, and he came to me the next day and was like, oh my God, like I haven't felt any pain since. And I was like, yes.
I love that. That's when you've like succeeded.
Yeah.
I love that. That's so cool. I know we've been talking a little bit more in terms of like the fitness and health stuff, but we also know that acupuncture, well, not lately, I've only learned about this recently, but you can also use acupuncture in terms of cosmetic use as well.
Yeah. And I mean, the brilliant thing about that is, again, we're using local points. So that's going to increase blood circulation. It stimulates like microabrasions within the skin. You're not going to, well, most of the time you won't bleed because it's, you can't really see the abrasions to the naked eye. But it's causing like micro trauma in the skin. And so your body reacts by producing more collagen. So it can fill out those fine lines and wrinkles. We use it as a preventative as well. But there are also, as well as getting that cosmetic benefit from it, there are the points that we're using are used for different things. So for instance, there's a lot of sinus points around the nose, around the eyes. There's a lot of ghost points. So they're points that we would use for mental health issues. One significant one is just on the masseter muscle. It's a ghost point used for PTSD. It's a stomach point as well, and it's also really good at relieving like TMJ symptoms. If people grind their teeth during the night, have clenched jaw, anything like that, Bell's palsy as well, is really good at helping to relax the muscle. So it's really interesting that it's, when we're stressed out, and, we may even do it subconsciously as like grind or just clench. So the fact that it's used for PTSD as well, so you're getting that whole, very much a mind-body connection between the two. So there's a lot of points like that. They have multiple uses, just depending on, what we need. But great points also on the head and within the scalp. I use for neurological conditions. So headaches, tinnitus, dizziness, hangovers. We use it to clear vision. There's actually a point on the scalp for pretty much anything. So, but a lot of headache points, like when people suffer from migraines or headaches, quite often they have a lot of tension within the muscles of the forehead. So it can be great at the same time as, getting like a mini facial is you're, helping relieve migraines, or, you've got chronic asthma or hay fever, and, we're working on that at the same time.
I love that. Such good points there. And now it makes so much sense why we've been putting a shitload of needles on my face. Yes. Now I literally know, so we're hitting the jaw. Cool. You're stressed. Yeah. Awesome.
Yeah. Well, there's also, so we have Chinese face reading as well. And with that, so we see that there are, depending on where your issues appear on your face, can tell us a lot about what's going on within the body. So, for instance, when I was at university, I started to develop eczema on my eyelids, and the eyelids represent the spleen. So this was occurring because of stress. Like when we get stressed, it can, block our qi, but then it also causes the spleen qi to become deficient. So initially we worked on sort of trying to clear, it was itchy, it was red. So we see that redness as a sign of heat, itchiness as a sign of wind. So initially we were working on like clearing some wind and heat, and it was kind of like helping a little bit, but not all that much. And then when we started working on the spleen, it cleared up like that. So there's different, when you have the number 11 lines, we see that as, a liver. So it could be like liver qi stagnation. That means you're probably stressed a lot, or you don't cope with stress very well. But yeah, depending on, where you get acne or where you get hyperpigmentation, can all of it can tell us what's going on inside of the body. Not only that, but how you see yourself. So if you're like, I really hate, my crow's feet or something like that, that can tell us like what to focus on as far as not just physically, but what's going on, inside your head and inside your body. So it's really interesting to kind of like map out people's faces as well.
I love that. You probably look at every client, you're like, what is wrong with you today? But it's, you know what, it's a fascinating way to look at the human body, because as coaches, we can only look at more of the physical stuff. Some of us can look at the
Yeah.
mental stuff.
Mm.
It's, you know, nutrition based, but you're like taking it to a whole nother level. You're literally diving
Yeah.
deep into the insides of someone's body by
Yeah.
only looking at the outside, which is just amazing.
Yeah. Well, I mean, the other techniques that we use are pulse diagnosis. So we've got 3 pulses on each side of the wrist, and each one tells us, refers to a different organ within inside the body. So depending on, I mean, there's so many factors to it, but you know, the speed, the depth, all these things can tell us what's going on within each organ. So that's a really good technique that we can use as well. And the other thing is the tongue. So the shape, the colour, the coating. I love looking at the tongue, because it's like I can tell like straight away. I'm like, right, I know where like I'm going with this.
Okay, well, let's
Yeah.
talk a little bit about the tongue then. So, what are some common cases that you see on someone's tongue?
So if you've got the scalloped marks, or the teeth marks around the edge of your tongue, that can relate to dampness. So this is a lot of like your food that you're eating. Are you feeling fatigued, sluggish? Are you overweight? Have you been consuming too much dairy? That's a lot of, that sort of really gut stuff. If you've got like a red tongue, there's no coat, it's a really dark red tongue, that's where we see things like that yin deficiency and the night sweats. If you have a quivering tongue, or your tongue is deviated, so when you poke it out, it kind of goes to one side, or if it's quivering, that's like wind, a lot of liver stuff. So again, we're looking at, that's a lot of emotional stuff actually. It could be stress, it could be something deeper. Someone who doesn't poke out their tongue very much, so we're like, show us your tongue, and you know, people poke it out. If people only like go poke it out like this tiny little bit, I'm like, that's emotions. There's a lot of emotions going on there. It's like you don't want to show what's going on the inside. It's a very, Shen, emotional tongue.
And I'm the complete opposite. I'll just stick my tongue as soon as you come in.
That's what we like. That's what we like. We see what's going on there.
I love it. It's so fascinating. What does it mean? I'm sure you like, obviously you've looked at my tongue so many times, but we know how I have this split in the middle.
Yeah. So that can be a sign of heat as well. It's to do with the heart. So again, like, you know, you've spoken about the, issues with sleep. So it can be a sign of that sleep. If it's red and there's no coat, again, that's going to be a lot of heart stuff. But it could also, if you've got that dryness to it as well, again, you're a bit yin depleted, and it's starting to get to a point where your body fluids are starting to get depleted. So this has gone past the point of nutrition, where you're depleted in your nutrients. This is now starting to affect your body fluids. So it's just like one step further. Yours is not at that point though. But yeah, there can be some, I've seen some like really deep cracks. A lot to do with the heart.
So much with the heart. And when we're talking about the heart, are we referring to the emotion side of things?
The heart, so we have the 5 main organs, the 5 yin organs, and each one is attributed to an emotion. So you've got the liver with anger, You've got the lung with grief. The heart refers to joy or overjoy. You've got the kidney refers to fear. And then you've got the spleen that refers to worry or overthinking. So each organ has an emotion. However, the heart is the governor of all the emotions. So it rules all of them. So if you do have an issue with one, chances are it's probably going to go affect your heart as well. So, you think about like with your kidney and the fear, that can affect sleep. And sleep is a big thing for the heart as well. Because when you're at peace and harmony and everything's balanced and you're feeling great, it's said that your spirit has got an easy, nice place to rest at night. So you rest peacefully. But if you're worried or if you're fearful, if you're stressed, if you feel anger, all of those things can affect the spirit. The heart houses the spirit, houses the mind. So all of those can affect the heart. And then it's like your spirit doesn't have like a safe, peaceful place to sleep at night or to rest at night. And so it wanders. And that's why we have insomnia. So, yeah, it's the heart has got a big thing to do with the emotions. Insomnia, palpitations as well. So when there's palpitations with anxiety or anything really, if you're feeling stressed and you start feeling those palpitations, that's a sign that there's something is not right there. So in this instance, like we're talking about, so people get confused between the organ itself as a physiological organ and the organ that we speak of in TCM, which is kind of like, it's just like telling a story or a representation of how our body works and how organs work together to be you.
So fascinating. Seriously, I think everyone right now is probably in front of the mirror looking at their tongues or like checking out their feet and trying to figure out what the hell is going on. And I think, to be honest, I think anyone should experiment or experience a acupuncture session at least, a few times to have a better understanding of what we've spoken about today.
Yeah. And I mean, the one thing is just to remember, it's Chinese medicine, as much as, we can help you when you're unbalanced, it's also great for maintenance as well. And just, keeping your body balanced. Sometimes I'll have people come in and they're like, I just want to try, but I've had insomnia for 10 years or something. And it's like, coming in for acupuncture once for insomnia that you've had for 10 years is a bit like going to the gym once and expecting to lose 10 kilos. Like you're not going to probably notice it with one session. Maybe you might for a day or two. But, in that instance, you need a couple of treatments. You don't, So that's one tip I'd give. But it's great to come in and just have a session, see what it feels like. But yeah, if there are specific issues, we usually during a consultation will give you sort of a plan, a treatment plan of this is what you need to do, this is what you need to take, this is how many treatments we'll do, and then, reassess it at a later date. Because everyone's different. Everyone's going to react differently. What works for you won't necessarily work for me. People need different timelines, different treatment plans. And, that's the beauty about acupuncture is we're treating you based on not just that symptoms, but other symptoms and your history. not, we're not treating that symptom. We're treating the person as a whole.
Yeah, I love that. So cool. So for those who want treatment, we know that, for our listeners, Dr. M'Lanie is based in Melbourne, but for our listeners who are in Melbourne, how can they reach you? Where can they find you?
So I'm at Zhong Centre. We are in St Kilda, just on St Kilda Road, corner of St Kilda and Inkerman. And if you're not in Melbourne, we also do telehealth consultations. Or if you did want to see someone in your city, wherever it may be, give us a call or send us a message, and we can probably hook you up with someone close to you. I think between the lot of us practitioners, we know, a few people around Australia. So yeah, if they need help in a different state, we can certainly try to help.
I love that. It's like the fitness industry. If we have a coach in Melbourne, but someone is wanting a coach in, like, let's say Sydney, I love how there's like a referral system. We're not competing against each other. We're working together to help people.
Well, I mean, you're doing it for the benefit of the patient. And I think that's what, I didn't get into this for the money. I got into it because I love what I do. And so, you're doing it so that you can help other people. And that was, one of the big things for me was being able to help people, which is why I love, helping people with their fitness journeys. And if they're training to compete or whatever it is, it's like, I'd like to give someone the support that I didn't have when I was competing, and, hopefully give them some advice as well. And, so that they don't have to go through what I went through.
Yeah, I love that. So good. Well, girls, you literally got a full 1 hour of everything to do with acupuncture, bodybuilding, trigger points. Like, oh my God, this episode was an absolute mind-blowing episode. I'm probably going to go now and take some notes right now to share it with my clients and be like, hey, go see Dr. M'Lanie. So girls, if you enjoyed today's episode, please make sure that you recommend it, share it, leave us a review, let us know your feedback, and screenshot it, share it on Instagram or whatever social platform you're on. Tag us at the Women's Fitness Academy. And then until next time, go get some acupuncture done.